Navigating America's healthcare system can be challenging even for people in the best of health. But for those facing a serious or life-threatening illness, it can be even harder. Not only can it be overwhelming and confusing to coordinate medical services and procedures, but figuring out how to access the types of services that can help them with their daily activities can be exhausting. Many of these patients with serious illness have multiple chronic conditions, like heart disease and diabetes, or struggle with a single life-threatening disease, such as cancer or Alzheimer's. And it's not just the patients who are frustrated with the nation's healthcare system. Families and caregivers also find themselves up against significant barriers as they attempt to ensure their loved ones, or those whom they care for every day, receive the proper services they need. These challenges begin with Medicare's payment and delivery system. Too often, services are based on what is reimbursed under Medicare, rather than what patients want and need. While Medicare covers the cost of hospital and doctor visits, there are other services that are not covered, like meal preparation, medication management, bathing, and grocery shopping. These less costly services provide quality of life to patients and allow them to remain more independent. Providers, patients, and caregivers often struggle to cobble together enough resources to provide these daily tasks that many people take for granted. While some patients are fortunate to have family members and friends fill the gap, others must look to local volunteers and social service agencies. But with such high demand for help, these organizations do not often have enough funding or volunteers to help those in need. Today, there are more than 3 workers for every retiree. In 12 years, that number will decrease by 1/3. To address these important issues, policymakers have suggested expanding the coverage of services under Medicare or creating a new program altogether. However, these solutions can come with a high price tag, and there is concern that Medicare is already overburdened. It's imperative that our country re-examine long-term care and retirement issues. But today's patients can't afford to wait until structural changes are made to deliver financially sustainable solutions. Until that happens, the Bipartisan Policy Center believes 4 actions should be taken in the short term to ensure patients with serious illness receive the care they deserve. First, improve person and family-centered care for Medicare beneficiaries. Second, expand access to telehealth services to patients in the home. Third, create a stronger workforce through better training programs. And fourth, support family caregivers through respite care benefits and care transitions from hospital to the home. With a rapidly growing older population in the U.S., improving the quality and management of care for people with serious illness must be a top priority. To learn more about BPC's recommendations, visit www.bipartisanpolicy.org/seriousillness.